Today, we're going to discuss some of the essential guidelines for safe sleep practices, particularly focusing on reducing the risk of sudden infant death syndrome, or SIDS. The guidelines in this video are recommendations from the American Academy of Pediatrics outlined by Dr. Kristen Betten and are designed to ensure the well-being of your little ones during their most vulnerable stages. First and foremost, your infant should always sleep on their back. Sleeping your baby on their back is one of the most effective things you can do to reduce the risk of SIDS. Always remember to place your infants on a firm sleeping surface, such as a firm crib mattress covered only with a snug fitted sheet. Loose bedding, blankets, stuffed animals, and other soft objects that could cause suffocation should be removed from the sleeping area. Make sure your baby is sleeping in a safe space. Cribs, bassinets, and portable cribs that meet the safety standards are accepted. It is important to note that some bedside sleepers with published safety standards may be acceptable, but in-bed sleepers without safety standards are not recommended. There is evidence supporting certain practices that may have a protective effect against SIDS. These include breastfeeding, regularly scheduled immunizations, and pacifier use during sleep. When it comes to pacifier use, it's important that you encourage it during sleep, but don't force it if your baby isn't interested. On the flip side, parents should avoid tobacco, alcohol, and illicit drugs as they increase the risk of SIDS. Dress your baby in light sleep clothing and maintain a comfortable room temperature to prevent overheating. This helps in creating a conducive sleep environment. It has now been suggested that infants should sleep in the same room as their parents on their infant sleep surfaces for at least 6 months and up to 1 year. This practice, known as room sharing, has shown new evidence in the guidelines to potentially reduce the risk of SIDS by up to 50%. It is important not to confuse room sharing with bed sharing, which leads me to my final and most important point. Regarding co-sleeping or bed sharing, it is important to note that there is currently no evidence supporting a safe way to co-sleep. Co-sleeping with infants, specifically under the age of 1, can pose a fatal threat of strangulation, suffocation, and SIDS. If parents choose to feed in bed, precautions must be taken to create a safe environment. Remember, while these practices can significantly reduce the risk of SIDS, it is important to discuss safe sleep guidelines with your pediatrician and stay informed about the latest recommendations. Thank you for tuning in, and here's to creating a safe and restful environment for our little ones. Until the next time, take care and sleep well.